What if I told you that trees and the natural environment have the power to heal both mental and physical illness? And that getting out and active in green space makes you healthier and happier. You probably think I've been spending too much time with Duncan, right? But there is increasing awareness of the links between well-being, physical activity, and access to nature. It has been shown to have very real medical, psychological, and societal benefits. Research has shown that living within half a mile of green space lowers the incidence of depression, anxiety, heart disease, diabetes, and asthma. In fact, just being within eyeshot of green space can reduce incidences of crime by as much as 50%. So in this episode, I'm going to explore the connections between the natural world and our health and well-being. In Ireland, we spend more per capita on healthcare than almost any other country in the world. But we're far from the healthiest nation. While much of the blame is often put on personal behaviour, the fact is that our health has a lot to do with our environment. There are many ways that the environment negatively affects our health. On average, 4 people in Ireland die every day as a result of exposure to air pollution. And noise pollution increases stress, which is linked to heart disease. However, an increasing weight of evidence reveals that close contact with the natural environment can be used to combat disease, enhance health, and improve overall quality of life. I'm going on a journey to discover how we might harness the power of nature to improve health and benefit our society. Woodlands for Health is an ecotherapy initiative that's been running in Wicklow since 2012. Ecotherapies encompass a range of treatment programs which unlock the potential of the natural environment to treat illness and improve well-being. A sort of green prescription for wellness. But what is the theory behind it? How can immersion in greenery benefit our health and well-being?
Morning, everybody.
Good morning, Charlie.
We're in Avondale again. Fine, lovely autumn morning. Just before we start off, we just do a little bit of warm-up. And stretch to the sides. Today we're going to walk the Centenary Trail. It's looking a little bit like showers, but we'll head off.
Yep. All right, great stuff. This pilot programme is a collaboration between the HSE, Wicklow Mental Health Services and Quilcha. It offers guided weekly walks in nature as a treatment option to people suffering from a wide range of mental health conditions, from depression to schizophrenia and suicidal ideation. And tell me a bit more about the walks.
The walks, we meet every Thursday morning and we go to different places, different woodlands all around Wicklow. And we go for about 2 hours and then we come back and we have a cup of tea and a chat. It actually gets us up in the mornings and stops us being sort of socially isolated, which is a big problem with mental health.
You're sort of out with a small group of people who you're sociable with, who are going through the same experience as you are, and you're getting to see the beauty of the woods and the nature. It's almost like kind of being in a stuffy room and you open a window to let in a bit of air. It kind of has that kind of effect, I think, for a lot of people.
And this is something you'd agree with, Sheila, is that you think being out here?
Yeah, definitely. It's better than any prescription. Yeah, definitely.
It's made a big difference in both your lives.
Yeah, recommend it, yeah.
So it's easy to open that window to get to the fresh air.
Yeah.
Charlie Burke is a recreations officer with Quilcha. He approached the HSE with the idea after coming across a similar programme run by the Scottish Forestry Board. Why are you getting involved in it, Charlie?
The reason why I'm so passionate about this is actually because I myself live with the diagnosis of bipolar disorder. I was diagnosed back in 1984. In 2012, I got the opportunity to join the recreation team, and I saw this as an opportunity for other people to benefit. Like for Quilta, we have 230 recreation trails around the country, we have forest parks, and you know, the benefit for people getting out for walks and into the environment is just fantastic, you know. And it's simple stuff and it works.
Recently, the programme was evaluated by the HSE and University College Dublin. And what kind of results did you see from that?
The results were exceptional. Suicidal ideation was down by 82%. Like, people's mood changed quite substantially. Sleep was improved by 62%. Reduction in agitation, anxiousness. Drug dosage has been reduced. Also, clinic appointments have been stretched out. They support one another instead of coming back to us as a service. And, you know, they keep in contact outside of the walking group as well. So it's been hugely beneficial.
So you think being in the green setting is actually massively beneficial
Yes.
for mental health?
Definitely.
The green prescription.
The green prescription, exactly, yes.
Dr. Justin Brophy is a consultant psychiatrist who oversees the programme and prescribes it as a treatment for many of his patients. Is this something you ever see as a full treatment for mental health issues?
It's probably never a full treatment for anyone with serious mental health problems, but I would easily assert that it helps the majority of people with mental health problems.
And do you think then if these people were to go into the city and walk around the streets and do this, do you think that you'd have the same effect, or is the green and the woodlands really making a difference?
Nature does seem to add something extra. What that is very interesting and the subject of much speculation, but nature is present and active.
Are mental health issues an increasing issue in today's society?
Unfortunately, it is. Mental health difficulties are growing in pretty much across the entire planet. That's a health catastrophe. We don't fully understand it. It's partly due to changes in our lifestyle, in our environment, in our social relationships, in our behaviour, drug taking. All of those are factors. But we need to do something about it, and we need something that's universal, that's free, that's easy to do, and that has measurable, important, supplementary benefits.
So there could be a lot of hidden health benefits and hidden cost effectiveness in this that we don't even know about yet.
Without a doubt. I mean, one hospitalisation for somebody, if you avert that, you're saving several €1,000 alone. So, if you multiply that across the country, you're starting to really see important health saving.
While nature-based mental health interventions are relatively new in Ireland, similar treatments are widespread in other countries. With antidepressant use at an all-time high and the demand for psychological interventions threatening to buckle an already overburdened healthcare system, programmes like this one could offer a cost-effective and readily available new option for mental health services. If nature can play such an influential role in treating illness, then it begs the question, what other benefits are there to getting out into green spaces? Dr. Brian Roach at Maynooth University is asking just this question. He's conducting an experiment to compare the effects of exposure to natural environments versus urban environments.
Come on, experimental careful.
So you can sit here. Just let the computer teach you what to do. So whenever you're ready, you can press the space bar and begin.
Brian's experiment has been long running, but today he's brought in 2 guinea pigs, Jamie and Dylan, to show us how it works. They're placed in an isolation booth and learn a word association task. After this, Dylan watches an 11-minute video of traffic, while Jamie is shown scenes of the natural world. Then, they both take a word association test to see if their cognitive ability is affected by which video experience they've had. And I'm here just in time to see the results. Hi Brian, how are you? Great to meet you. I'm really curious how annoying the traffic is. Can you show me a little bit of the traffic? I'd love to see it.
There's absolutely nothing about this scene that affords a positive feeling.
Oh, it's incredibly annoying. So then tell me a little bit about what we're going to see in the beautiful scene then of nature.
So this is a video of landscapes taken from aeroplanes and helicopters, all put together into a beautiful montage. And the incredible thing is that as soon as people begin watching this, within the first few seconds, you can actually see their shoulders drop. There's a completely different reaction.
So we took obviously a tiny sample today,
Exactly.
but give us an idea of how the two lads got on.
Okay, we'll look at Dylan first, who had the traffic simulated experience. Dylan got 20 out of 32 of the tasks correct, and he took on average 4.1 seconds, let's say, to answer each problem. On the other hand, when we look at Jamie's results, he got 32 out of 32 correct, and he took only 1.2 seconds per response to make his answer. So we see much more rapid responding and a much higher probability of being correct.
So then when you're getting these results, you're seeing that the people who are watching the nature video are genuinely doing better on these intelligence tests on the other side.
So indirectly, yes, we're actually showing that they're thinking more rationally, more quickly and more accurately in a problem-solving situation.
And tell me, Brian, why do you think that this is happening?
That's the $60 million question. There are several reasons. One of them is probably stress related. In fact, when Dylan left the room, he just said that was so annoying when he watched the video. Because of course it is annoying to be in a traffic jam, and that increases blood cortisol, which interferes with learning.
So if you're learning something new, even if you feel like you've learned it really well, unless you have time to actually let it settle in your brain, you're not going to be able to remember it.
That's exactly correct. And what this shows is that nature experiences seem to aid consolidation, which is good for memory and good for recall. So we need more of these experiences in our daily life.
What about health? What about psychiatric or physical ill health or good health? Can that be changed based on your green environment?
People that spend time outdoors and live in rural environments and have rural experiences as a large part of their day-to-day experience live about 4 years longer than people that spend most of their time in cities. But there are lots of reasons for that. Some of that is pollution and some of it is crime. But there's some evidence suggesting that no, some of it is simply the high stress levels that people in cities are going through from the unnaturalness of the environment. And as much as some of us love the city, the truth is that in evolutionary terms, it's not home. As hard as we try to make it so, it's not. Because if you take any species, as has been studied in the lab, and you put them in an unnatural environment, things usually do go wrong. They might stop mating, they might stop eating, they might stop protecting their young or foraging to collect food for the winter. They might start attacking each other. Cannibalism has even been seen in animals that have been taken out of their natural environment. They're called zoos. So the same is true for humans, but not many people are aware of this. We're in, effectively, a human zoo, full of concrete and noise and unnatural smells and sounds and so on. And so we are behaving unnaturally. You do get more crime and antisocial behavior in cities directly because of the design of the landscape.
So throwing on your hiking boots and getting out into nature not only benefits your health, but also makes you smarter. On the other hand, the lack of close contact with nature in the urban environment is negatively impacting our health. But it's not just our health. The research indicates that there's an association between the absence of greenery and higher levels of crime and antisocial behaviour. I wonder how real this link is. John Lonergan spent 42 years working in the Irish prison service, 22 of those as governor of Mountjoy Prison. He is so convinced of the link between environment and behaviour that he works with communities around the country to actively campaign for access to green space in their local areas.
While I was in Mountjoy, we carried out numerous pieces of research on the basis that we need to ask the questions: why do young people, vast numbers that are from very social disadvantaged areas, end up in prison all the time? This research showed very quickly that social deprivation was a main contributory factor. And as a result of their social circumstances, many other elements showed up, like lack of education, high levels of mental illness. 1 in every 4 had an inpatient history. 88% were unemployed.
Do you think that this is to do with the physicality of where they grew up as well? Do you think this has anything to do with the environment?
Well, I'm absolutely certain that I would say that's where it starts. If you have a very negative, depressing environment with lack of amenities, lack of open space, lack of all the sorts of things that stimulate people, well, then the consequences are that people feel very low about themselves. They have very low self-esteem and no confidence and no motivation. And so the vast numbers of young people, in my experience, never reach their full potential. It's a scandal.
I mean, what are we looking at if we don't make an effort to introduce green spaces into the environment?
We need to change the environment to help to change the people. You can't force change, but you can nurture it and you can encourage it. It starts with that, showing respect. How can you say to young people, we respect you, when you don't provide them with the basics? And then if you have nothing to do, if you don't need to occupy you, what do people expect? There's bound to be depression. And what's the first thing that people respond to? Drugs. Prescribed drugs or illicit drugs. They don't solve the problem, but they allow people to become oblivious to their circumstances. But it's not a solution. And then we have all the consequences of that. Environment is at the hub of that. But it's not the whole answer, and people wouldn't want to think that, well, we'll give them a pitch and then that's it. No, that's, for me, it's only the beginning. Not everyone will play sport, not everyone will play hurling, not every young person will. I would say that open spaces and facilities like to walk through, to have this nature around you, for little children to see birds' nests in parks and to all that sort of, that's all alien to this part of urban Ireland.
One of the campaigns John is involved with is right here in Dublin. The Liberties is the most densely populated area in the entire country, but it has one of the lowest levels of green space. The local community has campaigned for a number of years to have a derelict site redeveloped as a park.
There's a real lack of green space in the area. Basically, we have about 50,000 residents. And in some pockets, we only have 70 square centimetres per resident. So that's less than a picnic blanket within a 5-minute walking distance for relaxation or recreation.
Wow, and then does that result in any sort of social issues?
I mean, of course it does, but I think that's partly because of the lack of green space. So I think a lot of those hopefully will be addressed by getting more green space into the area.
This site's close proximity to the city centre makes it very valuable for development.
Throughout Dublin 8, we were promised football pitches, green area on the greening strategy, which nothing was ever acted on. And now there's a big time to kind of hold on to what space we have left and not give in to the growing city. Do you know what I mean? So we don't want to become a concrete jungle.
It won't solve all of the problems in the Liberties, of which there are many, but it would add to them if you did not have a park here in a green space. Can you blame people if they behave in an antisocial way if you deny them access to a park, to the things that most people take for granted but would think you're insane if you ask them to live without?
It's taken more than a decade of campaigning, but the Bridgefoot Street site has recently been rezoned for recreational use. So Zoe, then tell me, how does it make you feel that this might be on the horizon then for the Liberties?
I'm delighted, but at the same time, it's very important that we don't go back on this. We have to do this for the mental and physical health of the local children and families.
So this is something that's very important to you?
Critically important. It's related to my conscience. I couldn't just sit by and see people's lives wasted and health deteriorate for lack of a local park.
After a long campaign, the residents of the Liberties have something to celebrate. The rezoning of this derelict site is a step towards getting the park the local residents so desperately need.
We used to do a walk in here, you know, we used to do
15 laps. From that corner to that, from that to that, right around the whole lot. You do 15 times in the morning and the evening.
Just go round, you know.
And then go over then and sun yourself in the Mediterranean then over there.
So this was a Mediterranean.
But it remains to be seen if the funding can be put in place to convert the site into a healthy green oasis.
Politicians in particular, and local communities, local councillors, need to fight for those sort of basics. They're basics for me. They're not luxury because they're required and because they're justified and they are needed. They're not an option. They're an essential element of environment, of cultures and environments.
Retrofitting greenery into our urban centres will be costly, but until we do, we will continue to pay with our health and well-being. We are about to set out on the largest house-building programme Ireland has seen in a generation. As we gear up for this development, surely there must be a way to avoid repeating past mistakes. Going forward, is it possible to put these issues at the core of the way we plan our towns and cities? Professor Kevin Layden is currently working on aspects of urban planning and design as part of a research grant from the Environmental Protection Agency. I caught up with him to find out what is good urban design and how can that benefit us.
Yes. Great.
Investigate Beechwood.
Well, think about it historically. We used to do a very good job at building villages. We're in a village right now. It has a very village feeling, right? You can walk to everything. You can walk to the grocery store. You can walk to the hardware store. Children can walk to school. But for some reason, over the last 25, 30 years or so, we've gone in a very different direction, where we're building more car-dependent suburban estates, where to get any of your daily needs, even to go for a walk, you might have to get in the car and go someplace where it's safe to do so. The best cities enable people to get from point A to point B by multiple ways, and we all benefit from that. If you build more walkable neighborhoods, people are more likely to walk. If you have access to green spaces and sports facilities, they're more likely to attain the amount of physical activity they need on a daily basis to be healthy and to avoid obesity, for example. There's a role for the planner and a role for the engineer to make our places, the places we live in, more livable.
Well, then it seems like for town planners and engineers, there's a big responsibility there. Do they know that they're responsible for this level of people's health?
It's not just the engineers or planners, they're just part of it. It's the whole system. There needs to be a new attitude about the places we build. And that's going to take perhaps some kind of re-education or redirection of our developers.
So then what would you say to people who at the moment are talking about the fact that there's a housing crisis, there is an increasing number of homeless, and we are talking about green spaces and about parks? Is it not better to put more and more homes in and get people into houses? Is that not more beneficial?
I think it's a bad idea to just build homes without building communities. Houses make a part of the places we want to live in. And as we've been discussing, that means access to not only green space, but the places you need to be on a daily basis. So if we're going to be living in suburbs and cities, we need to get them right. We need to make them healthier places. We need to make them attractive. We need to make them places that people are proud of. And we need to think deeply about making cities better places to live and making cities more livable. That's what it's all about.
As a healthcare professional, I'm concerned about the health of our nation. Obesity is at epidemic levels, and other diseases such as diabetes and depression are rising rapidly. Designing and retrofitting our towns and cities with green space and getting out and active in parks and woodlands will by no means fix all our problems. But it's certainly a good place to start. The medical, psychological and societal benefits of access to green space have been repeatedly proven, and it is all of our responsibility to make it a priority. We owe it to ourselves and to each other to get it right.